This show is all about interviewing interesting people and learning. And right now, there is a trend on social media where women reveal all the plastic surgery that they've had. They also say what size breast implants they have, and they reveal the name of the plastic surgeon who has done the surgery. To talk about that trend and also everything breast surgery related, I have asked Dr. Steven Sigalove to come on the program. Dr. Sigalove is a board-certified plastic surgeon specializing in aesthetic and reconstructive breast surgery. He is an internationally recognized expert in his field. He's also based right here in Scottsdale, and that is why he's able to come into the studio today to talk more about it. Dr. Sigalove, thank you so much for coming in.
Thanks, Ellen. Yeah. Thanks for having me. Absolute honor. I am super excited to be here and to talk to you about anything breast.
Yeah, I know we're going to go like super in depth today, so I'm really glad that you are here.
Absolutely.
Before we kind of go in depth and talk about the trend that I was kind of just talking about, how long have you been a plastic surgeon?
So I started practice in 2004. Yes, it's showing my age. I've been in practice for 21 years now.
So what got you kind of interested in the field in the first place?
So, you know, medical school comes and you don't really know what you're going to go into. You do the various rotations. On my surgical rotation, I really knew I wanted to be a surgeon of some sort. So back in the day, you had to do general surgery first. So I went into my residency in general surgery. And when I was the intern in general surgery, I rotated on the plastic surgery service. So as the intern, you're kind of seeing everything, doing everything. And I was at Cook County Hospital in Chicago, which is like the knife and gun capital of the world, doing tons of trauma. And I was fascinated by all the trauma that was going on to people's faces, their mandibles. We were taking care of facial fractures, jaw fractures, gunshot wounds to the face, stab wounds, all these crazy traumas. And the plastic surgeons were the people putting all these faces back together. And so it really drew me into this kind of intricate world of detail. And then once I learned more about it, I realized that it really culminated in not only detail and technical things, but also an artistic side, which for me was really favorable.
And you stayed in Chicago, but like, so going from you're seeing like the worst of the worst when you're like at Cook County. How do you go from that to reconstructive breast surgery?
Yeah, so when I started practice in 2004, I did everything. Now, it just so happens that my wife is an oncologic breast surgeon. And so because of that, I started doing more and more breast reconstructions following mastectomy. Of course, I had to earn her confidence and trust just because we were married. She always sent out all the cards to everyone else, but eventually I got good enough and she trusted me with her patients. And so I started doing a lot of breast reconstruction, and then that really became the focus of my practice. So for 14, 15 years in Chicago, my practice consisted of probably 85% reconstructive breast surgery for patients who were afflicted with breast cancer.
Wow.
Yeah.
I'm sure that was like really emotional and I mean probably hard too, right? I mean,
absolutely. You know, one of the cool parts about my job is you get to kind of help make women feel whole again, particularly after cancer surgery.
Yeah.
My wife always has the hard job of taking care of the cancer and talking to the patients about this cancer diagnosis, and I kind of have the nice job of coming in and making them feel better about themselves, feel beautiful and whole again. And so I have to say it's like really gratifying taking care of patients and being able to give them a sense of femininity back after such a devastating blow as breast cancer.
Why did you decide to move, like first off?
Yeah, so
because you left Chicago eventually.
Yeah, so honestly, and we have had no ties in Arizona. We practiced in Chicago. And every year, my wife would go with her girlfriend to Miraval in Tucson to the spa. And every time she would come back, she would be so happy. And she was like, oh my gosh, I love Arizona. I love Arizona. I really want to live there. And so we thought at some point we'll just move there and probably retire there. Well, fast forward, things started changing at a rapid rate in Chicago. Things were just not what they used to be. And we said, let's just get out. So we literally just hightailed it out. We both found jobs here in the Scottsdale area. And in 2018, we made the trek and never looked back. And it's been amazing ever since.
Scottsdale is a place where plastic surgery it's popular, right? I mean, it is a popular thing.
Absolutely. I have to say, it was rather intimidating and scary starting in a brand new city where nobody knows who you are. I had a national reputation with plastic surgeons and with my own patients from treating them in Chicago and the Midwest, but moved to Arizona, nobody knew who I was patient-wise. So I literally had to kind of reinvent myself. I started day one from scratch. I said, this is going to be fun, and let's do this. So it was really scary, but at the same time, super exciting.
And like, so Midwest, okay, obviously you're doing reconstructive work in the Midwest, so that's a little bit different than just like cosmetic work here in the Southwest. But like aesthetically, is there a difference between what women want in the Midwest and what women want in the Southwest?
I would say that historically,
Okay.
from a cosmetic standpoint, the Midwest tend to be a little bit more moderate,
Okay.
a little bit more natural looking. People in the Midwest were not as outgoing with their plastic surgery. Certainly nobody's talking about what implants they have. If someone had a facelift, you would never see them in the grocery store. I think that the Southwest in particular, LA, Scottsdale area, I think plastic surgery has always been a lot more recognized.
Yeah.
And I think patients have a lot less inhibitions. And I think having great weather probably has a lot to do with it.
Yeah.
And I think the trend historically is, I think we tend to have used much bigger implants in Scottsdale and LA than Chicago, for instance.
Yeah.
So I think in general, things are bigger in the West, and the Midwest tends to be a little bit more conservative for the most part.
Yeah, it's warmer. I mean, seriously,
Absolutely.
you're wearing like, you know, swimsuits out here, you know, rather than like sweaters all the time, like in the Midwest. So I get it. When someone first meets you and like you're at a dinner party or something and they have no idea what you do, but then they ask you what you do and they find out what you do and they go, oh, you're a plastic surgeon. What's like the first question that they'll ask you typically?
So the first thing they always ask is, what's wrong with me? What do I need? And they turn, how's this? How's this? Are my breasts too big? Are they too small? What do I need?
Yeah.
It's classic.
Yeah.
Or I'll get another type of question where, oh, I've had 2 or 3 breast surgeries already.
Oh, wow.
You know, my breasts are really screwed up. Would you mind taking a look and, you know, seeing what I need? And that gets a little bit uncomfortable. but I get a lot of questions about revision breast surgery.
Wow.
Yeah.
Just like straight up at a party or something.
Yeah, like no, particularly after a few drinks.
Doc, come to the bathroom. Like, hey, here you go.
Exactly.
Well, yeah, it's funny because like Nip Tuck, I mean, that was a big show, and that was like early 2000s, I think. And I love that show. Now there was a Dr. McNamara on that show. So I, you know, was kind of into that show just like because of that. But that was the first line. It was like, tell me what you don't like about yourself. And that was how it started. And so people would come in and they would say, hey, you know, and it was kind of a freak show to begin with.
Absolutely.
But that kind of made it, I felt like it made it a little bit more normal almost, kind of.
Absolutely. I think it normalized plastic surgery. Maybe one of the first programs on TV that kind of normalized it and said, hey, this is something a lot of people do.
Yeah, totally. Yeah. So breast surgery in general, I just wrote some notes here. Breast augmentation, commonly known as a boob job, it's one of the most popular cosmetic surgeries worldwide. And according to the American Society of Plastic Surgeons, in 2022, so I mean, this is old, 300,000 breast augmentation procedures were performed in the United States, but that is just breast augmentation. So we have reduction, there's lifts, reconstruction, there's revision. There's a lot, right, of surgeries that happen when regards to the breast.
Absolutely. There's a lot of things we do to the breast. Sometimes we do one thing. Other times we can do multiple things. Sometimes someone needs an augmentation, but maybe they need a lift at the same time. Maybe someone needs a reduction because their breasts are too big. We also can work on nipples. Sometimes women can have what's called an inverted nipple, where it's kind of retrused and we fix it so it comes out again. There's a ton of different things we do on the breast. Again, sometimes you do one at a time, sometimes multiple things at a time. But it's a lot more complicated than you might think.
Yeah, I would think. And does it ever do you ever step back and you're like, wow, I fix boobs all the time. Do you ever just step back and this is my job, you know?
Yeah, I'm truly blessed and truly fortunate to be able to provide this type of service for patients. And it's really been an honor, to take care of someone, for someone to give me their trust that they know I'm going to take care of them from beginning to end to achieve their goals, or maybe to reconstruct them following cancer surgery. It really means a lot. So it's really humbling, to be honest.
Yeah. Well, no, that's the thing. I mean, you want someone to be happy, and that obviously if they're coming to you, they want to be happy. And first off, if they want a revision, they're coming to you because someone screwed them up. And so you need to fix them, right?
Yeah. So revisionary breast surgery probably takes up the majority of my practice. Probably 85% of what we do is very complicated revisions. We're kind of the epicenter of revisionary surgery in the Scottsdale area. A lot of complicated revisions are sent into us by other plastic surgeons who have kind of done as much as they can, and now they need someone who really focuses on these types of things. So we do a lot of complicated stuff. And I have to say, these are surgeries that are unbelievably rewarding, because a lot of these patients have had multitudes of surgeries. They've had 4, 5, 6 surgeries that have been failed. They're still not happy or satisfied. And so we kind of represent their last chance to have breast implants or to have a reasonably aesthetically nice outcome. So, it's super challenging because the surgeries are hard, they're complicated, they may take 5, 6, 7, 8 hours to do.
Wow.
Very complex. But the rewards are high, and typically patients are very, very satisfied and extremely grateful to us. So that really makes it worthwhile.
If there's not a serious complication, how long would a typical surgery take versus a really complicated case?
So a straightforward breast augmentation, first time breast augmentation, takes anywhere from 45 to 60 minutes.
Okay.
Quick, easy, in the recovery room for an hour and they go home, they're great.
Yeah.
The most complex of breast revisionary surgeries can take 5.5 or 6 hours.
Wow.
So a lot of intricate things. And I kind of look at the revisionary surgery very similar to the way I look at a reconstruction of a breast following a mastectomy. And so what I do is I kind of take the breast apart, figure out what's wrong, and then put it back together piece by piece. And so I'm building the breast up from the ground zero, and that is similar to the way we do reconstruction of the breast.
What you're doing is revolutionary, essentially, right? With kind of the new techniques of breast surgery. And when you first started, what were the techniques? Because I'm sure that it has dramatically changed, right?
Absolutely. When I was in my residency program, we were taught that every breast implant, whether it's cosmetic or reconstruction, has to go under the muscle. So we call that subpectoral. So everything was cut the muscle, put the implant under, and that's the way it was. In 2013, we were realizing that a lot of problems existed from being under the muscle. Animation deformities. Every time you move your pec muscle, the implant jumps up and down. So for reconstruction, especially when there's no breast left to hide it, you really see these implants going up and down. It's very unnerving. The patients didn't like it. So in 2013, we started changing the implants from below to above, and we started using this cadaver skin, and we called this new form of reconstruction pre-pectoral breast reconstruction. Dr. Alan Gabriel and I published our initial 350 patients, and in 2017 published our first big article that really changed the game for breast reconstruction. A couple of years later, everyone was doing on top of the muscle reconstruction. I parlayed that whole experience of over 1,000 breast reconstructions above the muscle to my cosmetic practice. And at the time, nobody was putting cosmetic implants over the muscle. Everything was subpectoral. We used to think that it was dangerous to put implants above the muscle because we thought incorrectly that the capsular contracture rates were so much higher. Well, what we learned was that the capsular contracture rates have nothing to do with whether it's above or below the muscle, but everything to do with the presence or lack of bacteria that can get into the pocket. So as long as you're performing good antimicrobial technique, If you're above the muscle, you have really no different capsular contracture rates than we're below the muscle. And we've published this, and it's now kind of a norm to put implants on top of the muscle. So I started doing this for my cosmetic patients about 10 years ago and never looked back ever since. And I still, to this day, rarely will go under the muscle for any of my cosmetic patients. And most of my revisions, I go from under to over because of the animation deformities, malpositions, or things of that nature.
And capsular contracture, for people who don't know, what is that? What does that mean?
So capsular contracture is the #1 complication following breast augmentation surgery, and it's basically when the body makes a big scar ball around the implant, and it makes it firm, hard, or even painful in severe cases requiring surgery to fix. The overall capsular contracture rate across the board is anywhere from 4 to about 18% with historically with the implants that we've had in the United States. And we happen to have a new implant manufacturer in the United States called Motiva that has a capsular contracture rate of 0.5%. So just by using these different implants, we think we're able to lower capsular contracture rates, which again is going to lower the need for reoperation.
Back in the day, there was saline, right? Like saline implants. And I'm sure there were other manufacturers who made them, and they were like, I mean, they were saline, right? Saline
it's like
in them.
Like a waterbed.
Right, and then like silicone kind of came out too. So Motiva, what's different about Motiva? Like how is, and why do you like this thing?
So these are what is called a 6th generation silicone gel breast implant. Most of the implants that we have right now in the United States are 4th and 5th generation silicone implants. The cool part about the Motiva implants, and the thing that makes this different and sets it apart from the rest of the implants here in the United States, Mentor, Allergan, and Sientra, is the fact that they have a true rough surface, which is 4 microns in height. And what it does is it creates a biocompatible, anti-inflammatory, reduces friction, and reduces bacterial attachment. All of those things go towards reducing capsular contracture, which again is the #1 complication of breast augmentation surgery. So these implants are soft, they're natural. When I put this implant and another competitor's implant in a patient's hand, I say, which one would you rather have? They all say, I'd rather have this. Why? Because it's a smooth silk surface, it's soft, it's comfortable, the gel is highly cohesive, there's minimal rippling compared to any of the other manufacturers. They come in 2 different styles. One is a classic round, which is round, and so for someone wanting a little bit less natural, a little bit more upper pole fullness, the round implant works beautifully, and the gel and the shell are a little bit less flexible, a little bit stiffer, whereas on the ergonomic style, which is a little bit more of a teardroppy shaped look for someone who wants a more natural look, this classic ballerina breast or yoga breast that people are talking about on social media now is best achieved with an ergonomics style implant because it mimics what a real breast looks like, which is really a teardrop.
And that's the thing. I mean, a lot of people are, as you said, this ballerina yoga. I mean, a lot of women are talking about a natural look now, right?
The natural progression that we're seeing nowadays.
It's not like this crazy. God love Dolly Parton. Everybody loves her, but it's not. That's not the style. And women are very athletic now.
This overdone breast look with huge implants is becoming less and less popular. Much more popular nowadays are use of much smaller, lower projected implants. So we're using like a mini projection and an ergonomic shape to give a really beautiful teardrop shape to create that ballerina breast or yoga breast. Smaller implants, particularly over the muscle, so we're preserving the natural tissue. We do a procedure known as preservation breast augmentation, which means we're preserving the majority of the tissues. We're not cutting tissue, we're not cutting muscle, we're preserving as much tissue as we can to achieve a natural result. The implant moves with the breast, it doesn't move with the muscle and make it very unnatural. So we've really changed the game in where we're putting implants and how we're putting them in.
How did, when Kylie Jenner put out that she had, 380 cc's and she put out her surgeon, how did that impact what you do? I mean, was that a game changer? I mean.
So yeah, a lot of patients were coming in and saying, hey, I want breasts like Kylie's. And I'm like, okay, easy. We know what implant she has. But a lot of people are saying, I know what I don't want. I don't want the Kylie Jenner look. I want,
because those are bigger.
Yeah, those are bigger, more projected. And so it's nice. You know, I ask all of my patients to.
But she's very open, right?
She's
I mean,
open.
that's like.
Absolutely.
And that's like normal now.
It is the norm. I ask all my patients to send in or bring in inspo pics for their consultation, so I know exactly kind of what they're looking for. And some will go on my Instagram, my social media, my website, my partners, or any website, and people come in with pictures so that I know exactly what they're looking for. Then when I'm doing their surgery, I have all their inspo photos on my screen, and as I'm doing their surgery, I'm looking at the inspos, making sure it works. So everything is just more open and comfortable nowadays.
Yeah, you don't put someone under general anesthesia. How is that possible?
So there is a extremely new procedure that we're doing nowadays, and I'm one of 35 surgeons in the United States who is trained in Costa Rica, where this was developed. It's been going on for 3 years there. The results are unbelievable, and it's a very minimally invasive, no cutting, no dissection, no general anesthetic. We're selectively putting small implants exactly where the volume is needed under a twilight anesthesia, under ultrasound guidance, with literally no or a very rapid recovery. Patients are back to work the next day. They're back in the gym less than a week later. It is a game changer because there's no pain post-operatively. The patients don't need pain medications. They're wide awake in the recovery room.
Wow.
It's an absolute game changer, and it's called Preservé. And it kind of sounds like preserve because we're literally preserving the tissues. And the way it works is we make a tiny incision, 2.5 centimeters in the crease of the breast. 2.5 centimeters, you can hardly see it. And instead of cutting and creating a big pocket and stuffing a breast implant, which is traditionally how we do breast augmentation surgery, by creating a big space and stuffing an implant in, now we're able to selectively dilate a tunnel up with a blunt dissector, use a balloon to stretch out a pocket exactly where we want the implant to be placed, creating what we call a nest. The nest recruits the natural tissues, and you put the implant through this little incision using a Keller funnel through the tunnel into your nest, and you have an instant, beautiful, natural breast augmentation. And the cool part about it is you can use much smaller, much lighter breast implants, which are not going to go south over time. The less weight you have, the better longevity of the surgery, the happier the patients. I brought some tools just to kind of give you an idea. So this is the little, it's called a channel dilator, and basically what we do is we go through a little incision and we just put this up through the breast tissue. It's over the muscle, under the breast tissue. We're using ultrasound guidance so I know exactly where it is, and we're just creating a tunnel. Once the tunnel is made, we put this little balloon through the incision exactly to the point where we want the implant to sit. We blow it up with air, it stretches the skin out, we take it out, and then deliver the implant. It's about a 20-minute procedure. There's no general anesthetic involved, which is incredible.
Wow.
The patients have no pain, there's virtually no recovery, and the cosmetic outcomes are superb.
Wow.
Yeah,
That's
it's
amazing.
a game changer. It's going to change the face of breast augmentation as we know it.
Wow. And you don't have like the general anesthesia fog, and you're not.
You have nothing.
Wow.
No pain medications, no narcotics.
Wow.
And 3-year data, capsular contracture rates are 0, infections are 0, and hematomas are 0. So it's incredibly safe. And it's really wonderful for that person who's like scared of anesthesia.
Yeah.
Maybe they're holding off on their augmentation because they just don't want anesthetic. This is the perfect procedure for them. It's called the Preservé breast augmentation by Motiva.
For someone who maybe doesn't want an augmentation, there are other techniques where, you've used like fat grafting, and that's also an option too, right?
Fat grafting augmentation on its own has kind of come and gone. A lot of people don't do that necessarily because the acceptance and the take rate of the fat is quite low. So you have to keep redoing it and redoing it. So a lot of times patients aren't that satisfied with just using fat, but we use fat all the time as a supplement. So if we do a lift and someone needs a little upper pole fullness or cleavage, we'll do fat grafting. We now have a fat grafting off the shelf, which comes from cadaver.
Wow.
And so just like you're coming in to have your Botox injected, you can come in and have some fat grafting literally under a local anesthetic in the clinic, no anesthesia, and instantly you get a little cleavage, or if you have little contour deformities or want a little upper pole fullness, you open the package, inject the fat. It's amazing.
Wow. Dr. Steven Sigalove, where can people find you on Instagram and also at your surgery center too?
So my Instagram account is at Steven Sigalove MD. Our website is scottsdalecenterforsurgery.com. We are the Scottsdale Center for Plastic Surgery, located in Paradise Valley.
Okay, we learned a lot today. We talked a lot about breasts, and I learned a lot. I hope you learned a lot too. And yeah, check him out on Instagram because I know you will learn a lot too. So
thank you so much.
Thank you so much for coming
Appreciate it.
in.
It's a pleasure.
Yeah, absolutely.
Thank you.
And thank you for watching this episode of The Curious Bee. We have a lot more up right now on Fox Local.